One of the other questions that some patients have is, well, do I have to take this medication forever? Now, that's true for diabetics, right? I mean, people with type 2 diabetes, they may be able to stop, especially if they can actually get their weight under control. But until that period of time, they have to keep on taking the medication almost indefinitely. However, for weight loss, that is still a question out there because there hasn't been a real large study that explores the weight loss and what the regimen should be. What we can tell you is that in our experience with our patients, they can stop and continue to sort of have that weight under control, or in some patients, even after they stop, they keep on losing weight. And we think that the reason why is they have early satiety, that even after eating a certain amount, they get full quicker than in the past, and they can't eat as much as they used to in the past. The other reason why we think this happens is that we continue to stress lifestyle changes even when they're on this medication. And it really is important to, number one, make sure that you eat the right type of food, well-balanced, small portions, maybe 2 or 3 meals per day. The other thing is obviously continue to exercise. Just can't avoid the fact that we need to continue to exercise to continue a certain amount of metabolic rate. Once that they actually get acclimated to doing this, that they continue to sort of do this out of habit. And even when they stop the medication, they continue to sort of be able to maintain that weight and not truly get a rebound effect. And so the rebound is extremely rare in our patients. Once they're on a therapeutic dose or a high dose, that we don't just stop the medication at that time. What we do is that just like how we initially start the medication, we start off slow, and then what we do is that we reach a certain plateau. Then if we're going to stop the medication, that we kind of taper it off. And we found that to be also extremely effective to avoid the rebound effect of weight gain. Overall, the patient satisfaction is extremely high. The effect is real, meaning a significant amount of weight loss with very few side effects. And done right, they continue to either lose weight or maintain that weight that they feel is ideal.